Welcome. For those people suffering with chronic heartburn, indigestion, acid reflux, you might have been diagnosed as having a hiatal hernia. A hiatal hernia basically is the diaphragm, which is the smooth muscle that separates the chest from the abdominal area. The stomach protrudes up into the hiatus, and as it comes above the diaphragm, digestion is altered. Acid reflux is quite common. You may notice that when you sleep, you have to sleep in an upright position. If you lay straight down, you get this burning acid regurgitation, and you may be living on antacids and all kinds of drugs, which is not the answer. There are natural ways to approach this. Although for this particular video, I want to show you a simple technique that I have done over many years that has helped many people. Now, there is really no harm to this technique, although there usually is only good outcomes if you are a candidate or if you have a situation of that diaphragm, where that stomach is sitting above the diaphragm, to where you're possibly having a hiatal hernia. Now, the true way to know if you have a hiatal hernia is through an ultrasound, a diagnostic test where they can actually visualize the difference of the stomach where it sits above the diaphragm. Now, all we need here is a tennis ball or a little therapy ball or any ball that is somewhat this size, around the tennis ball or a little bit smaller. And what we're going to do first is that we want to lay back on our back. We want everything to relax. We want the abs to relax. And I'm not going to do it sitting up because the muscles are contracted, the core is contracted. And the more things are relaxed within the abdominal area, the easier it's going to be. So let's show you how that works. So we're going to do this procedure very simple. Keep the knees slightly bent, relax the hip flexors, back should feel nice and relaxed. The abs are relaxed, all the muscles are relaxed. You have your tennis ball or your therapy ball or any kind of ball similar to this. We're going to feel underneath the rib cage in the middle. On the bottom, it's called the xiphoid process. You can see that the xiphoid process is the lower part that sticks out down below. I want you to get below the xiphoid process. So feel that bone in there and come right below it. Take that tennis ball or your therapy ball and push it straight down. When you take a deep breath and blow it out, as you blow it out, you'll push down and you'll roll it down. Good. As you take a deep breath, blow it out, and you're going to push down, and you're going to roll it down. You're going to roll it down about 3 inches or so. That's good. Take a deep breath, blow it out, and you're going to roll it, push down, and roll it down. Now, by rolling down, we are changing the configuration of the diaphragm as the stomach is protruding up and putting pressure in there. And the objective of this is bringing that top of that stomach region that's protruding through down again, through that pressure, and by doing that, we are hopefully solving the issue of that type of ailment that's causing a lot of your distress and acid. I always recommend follow up with your doctor or doctor's recommendations to get clearance if you're going to do any procedures. This is something that can make a big difference, and when you do this particular type of technique, you're only going to do this 5 or 6 times. And you can do it daily. I would not overly push hard or do anything that's going to hurt you. And most important, I think being in a lying position where everything is relaxed is more helpful. I really hope that this makes a big change with your health ailment. Although, remember, diet is still important. Cutting out fats, heavy meals, drinking a lot with your meals because you lack digestion and you lack enzymes. Spicy foods, fattening foods, fried foods, all those things you need to really cut out. Eat lots of greens, which makes your blood alkaline, which is healthy for you. Fruits and vegetables are excellent. Whole grains, fishes, and again, eating smart makes a big difference. But again, for those people that like to eat late before you go to bed, cut that out. That will add to your problem. So I ask you to leave your comments below. Thousands of people read these comments, respond to them, and learn from them. I ask you to subscribe if you haven't so you can continue to receive the best of the self-help videos here on the internet. And most important, make it a great day. I'm Dr. Alan Mandell.